people who are underprivileged. So technology is coming to the rescue of people who are underprivileged. And treatment in Sanjeevani is given free of cost to the people who are poor, and nominal charges from the people who can afford to pay. And it's Malabar Cancer Care Society is an NGO running on no profit, no loss basis, and the cost for treatment of those people detected with the first stage cervical lesions are borne by the panchayats or NGOs. They just subsidize the cost. The modus operandi is through screening camps. This house-to-house survey is house survey by trained volunteers. These trained volunteers, these volunteers are trained by doctors of Malabar Cancer Care Society. They have got a gynecologist and ENT surgeon, two people trained in colposcopy, and one cytologist. Before organizing a camp, they recruit the volunteers and give advanced training to volunteers over a period of 1 week, how to detect the cancer, what are the questions to be asked. These people then conduct house-to-house surveys and register people for the camp. Then people are asked to come to the screening camp. At the time, Sanjeevani won't be taken. Initial screening with the help of this colposcope and other equipments. Doctors will screen, and those cases, whom they find to be typical cases of, they are asked to come to Sanjeevani for surgery and further evaluation. And also those confusing cases are referred to Sanjeevani for online consultation with the specialist in RCC. Then these screening camps are again the feeder camps for the Sanjeevani. After some 3 or 4 screening camps, one Sanjeevani camp will be set up, and all the people who have attended the earlier screening camps and also fresh people come to the camp for medical assistance. Many screening camps were conducted from January 10 to May 10. 1,584 people were screened so far in 12 screening camps in Kannur and Wayanad. Detection of 51 CN cases, that is a precancerous lesions, precancerous cervical lesions, 6 precancerous oral lesions, and 1 suspected breast cancer case were identified in the screening camps. Oral cases were referred to the dentist for surgery. Breast case was referred to hospital for biopsy. People with the suspicious symptoms referred to Sanjeevani camp. All those people who had typical precancerous lesions of the cervix were also referred to Sanjeevani for giving this cryotherapy. These are the break of the results. Then Sanjeevani camp, what are the specialty of Sanjeevani camp? Those people who need X-ray, ultrasound, video colposcope, etc. are provided as decided by the doctor. Then those confusing cases, online consultation with the specialist of RCC for confirmation. Then for those people who have already undergone treatment for cancer, they can come to Sanjeevani and have online consultation with their doctor, X-ray, ultrasound, etc. so that they don't have to travel 400 kilometers to regional cancer center for follow-up consultation. Then those cases, typical cases detected with the precancerous lesions are given cryotherapy in Sanjeevani. 6 camps of Sanjeevani conducted so far, that is from January 2010 to July 2010, 5 camps in Kannur and 1 in Wayanad. In addition to the earlier cancerous lesions detected in the screening camps, 6 new cases were precancerous lesions by VE technique, which is an approved technique by WHO, and 6 by pap smear was detected in Sanjeevani. These are in addition to the cases detected in the screening camps. Then 17 women were given cryotherapy in Sanjeevani. Other ladies were referred to hospital because some had multiple infections, then ectropion, then cervical erosion, other complicated cases which need first attention before this cryotherapy. Also, in some cases, this columnar junction was not visible. 1 leaf surgery was performed, as I mentioned earlier. These are the breakups of Sanjeevani results. So, conclusion. Mobile tele-oncology units like Sanjeevani can play a vital role in cancer control in rural areas. Dr. Lele was telling us day before yesterday that prevention is better than cure. So early detection and giving awareness to the people in the rural areas in the methods of prevention will get rid of, will control the cancer, spread of cancer to a great extent. Then follow consultation of cancer, consultation from RCC, from Persian locality. Those people who have already undergone treatment can have consultation with the doctors of the RCC from their locality. They don't have to travel. This will be especially helpful for the underprivileged. Mobile units can create awareness among the people. That is continuing medical education. So once people are given awareness of such sort of a disease, people will be more cautious and do away with the unwanted behaviors and habits. Then when cancer is detected in the initial stage, the cost of treatment is just a fraction of when it comes, assumes a big, spreads. With a minuscule expenditure, it can be cured and treated. It also minimizes the travel for people. Thank you.